Jeopardy! Game show host Alex Trebek taking a leave of absence while he recovers from a brain procedure called an evacuation of a subdural hematoma. The 77-year-old says he developed a dangerous neurological disease from a head injury after a fall in October. Here's Alex Trebek from a video from his home posted on Jeopardy's official website.
I had a slight medical problem. Subdural hematoma, blood clots on the brain caused by a fall I endured about 2 months ago. Surgery was performed. The prognosis is excellent, and I expect to be back in the studio taping more Jeopardy programs very, very soon.
Dr. Paul Sapphire is a vascular neurosurgeon, Atlantic neurosurgical specialist, and Alex Trebek looks great. I'm happy to see that,
sure
Dr. Sapphire. But first, if you would explain to us what is a subdural hematoma and how does it affect the brain?
So subdural hematoma is a collection of blood that accumulates between a membrane that's just outside the brain and between the brain itself and that membrane. And so I have a model of a skull here and a brain. If I were to take off the bone that is the skull, you see the brain underneath, and between the brain and the skull is a space, and that's where a subdural hematoma would accumulate and can potentially put pressure upon the brain.
And how does that affect the function of the brain?
It can be varied. So there's a couple different types of subdural hematomas. There's an acute subdural hematoma, which is when we think of people in severe accidents or motor vehicle accidents or collisions. They can develop an acute collection of blood that rapidly expands and can thrust somebody into a coma or even kill them. In a subacute or chronic subdural hematoma, which is what Mr. Trebek suffered from, usually there's an innocuous injury. They hit their head on something that you and I wouldn't even think about, a kitchen cabinet or a car jam of the doors you're getting in. And slowly over time, this blood accumulates and slowly pushes pressure on the brain. Sometimes patients can have very large subdural hematomas and have very few symptoms. Sometimes they can have seizures, they can, like I said, have comas, they can have paralysis, all these different things.
And so is the procedure to go in and drain the blood from that area that is collected?
It is. When these subdural hematomas are large enough and symptomatic enough, really the only treatment is to remove that blood. The best way to do that is to open up the skull one way or the other, depending upon where that collection is, and physically go in, drain that collection. Oftentimes we place a small little plastic tube or drain in there, keep that in place for a few days, and then over time the brain, as that hematoma is evacuated or removed, the brain will re-expand up.
Oh, that's good. So Mr. Trebek, who looks fantastic in that video, I'm happy to see that, he can, after the surgery, which took place mid-December, he can have full functionality of his brain and everything can go back to work as he just promised?
People can make complete recoveries from this, as you can imagine. There's a tremendous spectrum as to how people might do. There is a chance of reaccumulation. There is certainly a chance of complications, so on and so forth. But usually patients can do quite well if it's caught early enough and treated successfully.
Now, Mr. Trebek had the fall in October. He didn't have the surgery until 2 months later, which means that he didn't see severe enough symptoms to go ahead and for the doctors to go ahead and to perform surgery. What are the symptoms? How do you know, like, oh, I didn't just bump my head? Or what's the difference between this and a concussion? So many questions here.
Right. A lot of great questions. And typically the story, a very classic story that I'll see when I see a patient that has this condition is they had a fall. They hit their head. October. And then over the course of the next few months, maybe their family members or their spouse or whoever noted that they're acting just a little bit different. Their headaches are continuing to get worse. Sometimes they have personality changes, severe, obvious symptoms such as seizures and coma. I mean, that's quite obvious. But the more subtle things is maybe just someone seems a little bit off. Their balance is off. They don't feel well. Again, the headaches are getting worse, so on and so forth. And that's because this hematoma slowly accumulates and slowly pushes pressure. We have some pictures. I'm not sure if they're on the screen, but there's a patient that I operated upon that had actually a pretty large subdural hematoma that accumulated over time. And as you can see, the right side of that screen, which is the left side of the patient, is a very large collection between the bright white, which is that skull, and the squiggly lines, which is the brain and the inside. And that is a big collection of blood there. So what was done for this particular patient is we performed surgery, placed a small little tube or drain. You can see that's bright white line that's in there now. That's actively draining out that collection. And then ultimately the next picture is the brain has fully re-expanded up and the patient's healed, and the patient did quite well. Very similar story to Mr. Trebek's.
And Mr. Trebek says that the doctors gave him a great prognosis. He's going to be back to work. And does he have to be extra cautious now about maybe not bumping his head, like you said, on opening a cabinet door or something like that? I mean,
well, common sense. I think he needs to be a little bit careful for that sort of stuff, and he has some recovery to be done, that's for sure. But he seems like he's doing great. I'm sure he'll make a complete recovery.
Oh, that's really good to hear. Dr. Paul Sapphire. Sometimes we have your wife, Dr. Nicole Sapphire, on with us.
She's great.
She is. You're as equally as great. So Happy New Year to you, and thanks for coming to explain this very important story to us.
Thank you.
Thank you.